Next, we'll perform the wrist physical exam. In general, we don't have quite as a standardized flow for the wrist. Depending on where their pain is, we'll generally focus in on that area. But in general, we'll ask them for range of motion. Great. Spreading the fingers out. We'll check for strength of the fingers, resist me. Good, good. And we'll check for just stability. Good. Good. So range of motion is normal for him. Stability is normal. I'm going to have him ulnar deviate and resist. Good. And I'm going to have him radial deviate and resist. Great. That's normal. So next what I'll do is get into palpation. So we'll palpate some of the areas. Go ahead and relax here. Yeah, just give me your weight. Good. So any tenderness through here.
No.
Okay. Through here. In through here. Great. How about here? Great. So as the clinician is palpating these areas, you don't have to get all of them, but what's important is that if there is a tender area, that you document that. If it is non-tender to palpation, you can just say wrist is non-tender to palpation. Because we'll know that we have examined the CMC joint, the radiocarpal joint, the distal radial ulnar joint, the mid-carpal rows, so all of that. A common presentation for wrist pain would be carpal tunnel, and a lot of people will complain of numbness and tingling in the median nerve distribution. So how do we demonstrate that? This is where Tinels comes into play again. So we're going to tap right here at the carpal tunnel, ask him if he has any numbness and tingling. No. Okay. So if the clinician is tapping in the middle of the palm here, kind of where this crease comes, that is the carpal tunnel. If they're tapping a little further over here, this would technically be medial anatomic position. This is the Julians canal. So you have carpal tunnel where the median nerve traverses, but you also have Julians canal where the ulnar nerve traverses. People can have problems with Julians canal and paresthesias in these fingers related to that. So we're going to tap at Julians canal. So again, what's this called? This is Tinels, but we're at Julians canal and not at the carpal tunnel. Any symptoms with that? Great. All right. Next, what I'm going to have Rob do is a test called Phelan's test. So I'm going to have you go like that. Yep. Try to bring your wrists parallel to your elbows. Great. And basically, if you look at the formation here, he's compressing his carpal tunnel in the median nerve with this. So we let it sit like this for a while and see if he gets any of his familiar neuropathic type symptoms with this exam. And this is called Phelan's. Anything with that? All right, so Phelan's is negative for him. Again, with the wrist and some of these distal extremity joints and problems, a lot of the exam will be based on ultrasound findings, because with the ultrasound we'll be able to look through all of the extensor compartments of the wrist, the flexor compartments of the wrist, the carpal tunnel. We'll be able to look at the joints within the wrist. We'll be able to look at the metacarpal phalangeal joints and the first CMC joint. So all sorts of different areas that we'll mostly focus with using ultrasound to help us with the diagnosis.